we're going to review image acquisition for the FAST exam. You can start in any quadrant. Typically most start in the right upper quadrant or Morson's pouch. You do a longitudinal or sagittal approach, and ideally you want to catch the inferior and superior pole of the kidney. So you can see here I'm just kind of sliding back and forth. You can see on the screen inferior pole of the kidney, superior pole. You're going to see fluid collect right anterior to this region first, and it could extend into the liver, into the Morson's pouch region here. If you want to extend the FAST and look for fluid in the thorax, you can see I'm sliding upwards towards the lung. And there's the diaphragm there, and you don't see black line in the lung field. Also you see a mirror image, so this is normal. The liver looks similar like it's in the lung. You want to make sure you fan all the way through, looking for fluid in the Morson's pouch. From there, you can go on to a different view. So typically it's another sagittal view. Now we're going to look at the bladder. So depending on the last time the patient urinated, you can do a sagittal view here, and you're looking for free fluid. So here's his bladder here, so you would look for free fluid inferior and anterior to the wall. You'd see almost a double wall sign. I'm in a sagittal view here, I'm pointing into the pelvis. You could also switch your probe to a transverse view, again with the probe indicator to the patient's right, your left, and fan through that way as well. Moving over to the left quadrant, it's a little bit more posterior. Again, I'm in a longitudinal sagittal view. And there's the kidney there in view. And so ideally you want to try to catch the spleen-kidney interface. So there's a rib shadow on the screen. You're looking for fluid to collect between the spleen and the kidney here on the left side. Furthermore, you're looking for free fluid superior to the diaphragm here, which you do not see. And then you'd also fan through for completeness to make for sure you didn't miss any small amount of free fluid. And then you finish your FAST exam with a subxiphoid. Typically, you would flatten the probe out here, you'd push in, and you'd have the patient hold a breath. Take a breath in, and you'd hold a little bit of pressure here, and you can see on the screen the right ventricle, the left ventricle, and then the aorta. You can adjust the depth. Usually you have to kind of pull your depth out a little bit, and then you try to see fluid, especially dependent on the subxiphoid view. You can take a breath. If you can't see the fluid on that view, you can adjust into a different cardiac view, such as a peristernal long or apical view, to help with that.